Imagine getting a fever that could kill you, and the nearest thing to a doctor is a pile of leaves. No pills, no hospital. No idea that germs even exist. This was the reality for every human who ever lived, for 300,000 years. And somehow they survived long enough for you to be here. So how did they do it? You feel it start in the back of your throat, a scratch. By evening, your body aches, your head is pounding, and your skin is hot to the touch. But you know exactly what to do. You open a cabinet, swallow 2 pills, and by morning the fever breaks. The whole crisis is handled with a plastic bottle you bought for the price of a sandwich. But for almost all of human history, there was no cabinet, no pills, no doctor to call, no antibiotics, no concept of infection at all. When your ancestors got sick, they faced it with nothing but their body, their knowledge, and the people around them. And the way they survived is stranger and far more impressive than you'd think. Because your ancestors weren't helpless. They were their own pharmacy, their own surgeons, and their own hospital. Let's start with the most important doctor they ever had. Their own body. That fever you rushed to kill with pills? It's not the illness, it's the cure. When your body detects an invader, it deliberately raises its own temperature, because most bacteria and viruses that infect humans reproduce best at exactly 37 degrees Celsius. Push that temperature up a few degrees, and you sabotage them while your immune cells work faster. Your ancestors couldn't lower a fever, so their bodies were allowed to do what they evolved to do. The discomfort you feel is a 300,000-year-old defense system running exactly as designed, and it started even earlier than the fever. That feeling of disgust when you smell rotten meat, the bitter taste that makes you spit something out. Those are ancient survival tools. Bitterness is how your tongue detects plant toxins. Disgust is how your brain keeps you away from decay and disease. Before anyone understood infection, the human body already had an alarm system for it, written into your senses. But here's the part that surprises most people. Ancient humans didn't get sick the way you imagine. The great killers of history, smallpox, measles, the flu, tuberculosis, the plague, almost none of them existed for early humans. And the reason comes down to 2 things: crowds and animals. Most of these diseases are zoonotic, meaning they jumped to us from domesticated animals, cattle, pigs, chickens, animals hunter-gatherers didn't live packed alongside. And a disease needs a dense population to spread. A measles outbreak burns out almost instantly in a band of 30 people. It needs a city of thousands to survive. Anthropologist Richard Lee, studying the Juhuansi people of the Kalahari in the 1960s, documented groups living in small, mobile bands, rarely more than a few dozen people, spread thin across the land. In that world, an epidemic has nowhere to go. The crowd diseases that would later kill hundreds of millions simply couldn't take hold. That changed 10,000 years ago with agriculture. Humans settled down, packed together, and moved in with their animals. And the plagues arrived. The skeletal record is brutal. Early farmers show more infections, more disease, and shorter lives than the hunter-gatherers before them. We didn't invent medicine because ancient life was riddled with plague. We needed medicine because civilization created the plagues in the first place. Still, ancient humans got sick. They caught infections, parasites, wounds that festered. And this is where they stopped being patients and became pharmacists. In a cave called El Sidrón in northern Spain, researchers analyzed the dental plaque of Neanderthals who lived 50,000 years ago. Locked in that hardened plaque, anthropologist Karen Hardy and her team found something astonishing. One Neanderthal, suffering from a dental abscess and an intestinal parasite, had been eating yarrow and chamomile, plants with no nutritional value and a bitter taste. Plants that just happened to have anti-inflammatory and pain-relieving properties. They had also been chewing poplar bark. Poplar contains salicylic acid, the active ingredient in aspirin. A sick Neanderthal, 50,000 years ago, was self-medicating with a natural painkiller. They weren't alone. In 1991, hikers in the Alps found a 5,300-year-old frozen body we now call Ötzi the Iceman. Inside his gut were the eggs of whipworm, an intestinal parasite, and in his belongings, carefully carried, were pieces of birch polypore fungus, a mushroom with antiparasitic and antibacterial compounds. Ötzi wasn't carrying it by accident. He was carrying his medicine. This knowledge was everywhere. "Honey, used across the ancient world, is naturally antibacterial. It draws water out of bacteria and kills them, which is why it never spoils. Clay was eaten to bind toxins and settle the gut, a behavior we still see in animals today. Specific plants for wounds, for fevers, for pain, for childbirth. This wasn't superstition. It was a pharmacy built over thousands of years of trial, error, memory, and death, passed down through every generation. Losing a healer meant losing a library. And when medicine wasn't enough, ancient humans did something that sounds impossible. They performed surgery. Across Neolithic sites in Europe, South America, and Africa, archaeologists keep finding skulls with clean, deliberate holes cut into them. It's called trepanation, drilling or scraping through the skull of a living person, possibly to relieve pressure, treat head injuries, or address seizures. It's one of the oldest surgical procedures on Earth, dating back over 7,000 years. And here's the staggering part. On many of these skulls, the bone around the hole has grown back, smooth, healed, remodeled. That regrowth only happens in a living body. It means the patient didn't just survive the surgery. They survived it for months or years afterward, with no anesthesia, no sterile tools, and no antibiotics. Some skulls even show multiple healed holes from separate operations. These people were performing repeat brain surgery in the Stone Age, and their patients lived. But the single greatest medical technology ancient humans ever had wasn't a plant, or a tool, or a fever. It was each other. In Shanidar Cave in Iraq, researchers found the skeleton of a Neanderthal man from around 60,000 years ago. He had a withered arm, a healed broken bone, arthritis, and was likely blind in one eye. He couldn't have hunted. He couldn't have defended himself, and yet he lived to around 40, old for his time. Someone fed him. Someone protected him. Someone kept him alive long after he could contribute anything at all. In Dmanisi, Georgia, an even older skull was found belonging to an individual who had lost nearly all their teeth years before death. Without teeth, they couldn't chew raw meat or tough plants. Someone was processing food for them, softening it, maybe chewing it for them, for years. No other predator does this. A lion that can't hunt dies. A wolf that can't keep up is left behind. But a human who couldn't survive alone was carried by the group. That is the real answer. Ancient humans survived getting sick because sickness was never something you faced alone. Care wasn't a luxury. It was the technology. In a world with no doctors, the entire band was the hospital. And now think about how you handle illness today. Alone in a room. A bottle of pills. A body whose fevers you suppress, whose bitter warnings you override, whose ancient immune system evolved for a world of clean air and small bands. Now facing crowd diseases it was never built to meet. You have more medicine than any human in history, and in many ways, your body is fighting battles your ancestors never had to. They had no doctors, but they had fever, instinct, a pharmacy of plants, the courage to cut into a skull, and above all, each other. And for 300,000 years, that was enough to keep our species alive. If videos like this are what you're here for, stories about what your body still remembers, hit subscribe. It costs you nothing and it keeps this kind of storytelling alive. See you in the next one.